Hello, everyone. Just wanted to let you all know, congrats on getting this far. For a lot of you, this will be our last formal actual study session slash slides that we go over for our class before we jump into exams and then practical. So if we don't actually have time to converse or talk about anything until these exams or practicals go on, and you get to go on with the rest of your tests or the rest of your summer break, then have fun with that and congrats. Moving on, I just wanted to go over a couple of going forward things, just general reminders. Exam 5, that's going to be this Thursday. Make sure you're prepping for it. It is everything that we have gone over since the first exam, so just prepare for it. If there's any questions, you can just feel free to email me before Thursday so that I can get that taken care of. So tonight, Wednesday, and Thursday morning. Make sure that you have your CPR AED certification sent to me by May 1st. If you're going to have any type of time delay, make sure you include me, Sherry Juergens, and Mariah Clay in an email altogether saying as to the reason why you can't get it done, so we're all on the same page. After that, I need to make sure that all papers are due April 28th. If you happen to hand them in late, we can give late credit for that. It's mainly just make sure you get them done so I know that you actually did the work. Otherwise, you're going to be losing 100 points, which would be obviously a fifth year grade for one of those papers, and 20 points, which is maybe a 20th or 30th of the grade. So it's not too much of a deal with that one, but still, I just don't want you to lose points unnecessarily. And beyond that, prep for the practical exam that's going to be next Monday, or this upcoming Monday, I should say. From what I saw on the school site, it says that we are supposed to be scheduled for 11:30. If I am wrong, please feel free to let me know. I tried double checking with the class, I think last time we were there, but just in case I make mistakes, so let me know. For those of you that weren't actually there for the practical study session where we learned about some of the special tests, what's going to happen is we're going to allow everyone to take the Exam 5 test in class, so then everyone that finishes will be allowed to go outside, and then we can practice those skills out in the main lobby for you in case you weren't there for that, so that we can actually get you up to speed so that you don't bomb the practical exam. Because even if I'm only taking 10 points off for each skill that you can't perform, if you can't perform any of the 4 skills, that's 60%. I don't need you losing 40 points off your grade. It's going to be the same format as the last practical, so you can do it in groups of 2, so you can kind of have less you have to worry about in terms of skills actually needing to be performed by divvying up the responsibilities among you and companions. If you don't trust anyone to do the tasks alongside you, then I would say do it on your own. And beyond that, make sure you all have a great summer break. So let's actually jump into these slides. It's going to be pretty short, nothing too crazy. Chapter 23 and 24. This is going over additional health concerns as well as dealing with young athletes, because youth athletes are not adults, all right? They tell you that type of stuff in PT. They tell you it in personal training. They tell you in athletic training. Athletes that are young need to be treated than athletes that are old. It also includes master athletes and grandfather athletes, but this is just getting more into the meat and potatoes of the matter, not the specific possible conditions. So starting off, we're getting into some skin conditions. Starting off, we have ringworm or tinea curis, all right? Technically, there are 3 different types of tinea that you can get that can be considered a ringworm or fungal style infection that can appear anywhere throughout the body, but this is the one that we are most concerned with because it is the most common. So, tinea curis is known as jock itch. That's because it is by location, which is why it is in the groin with cruris there. You're going to notice with a lot of terminology actually is it can actually relate to the portions of the body you will actually see it on. So if it's going to be on the groin, it's actually going to resemble a butterfly shape. Technically speaking, with a ringworm, the reason why it actually appears as a ring is because a fungal spore will appear on your skin, and then following it appearing on your skin, it will actually spread out before it will quote-unquote bloom, which is why you get that ring shape, is because there was actually a singular spore or spores in the area before they spread out, creating a blooming effect, that ring per se. So that's why with this, you're going to see something that looks a bit more butterfly shape. That is because the nature of the groin, it bends, crushes, curves, or touches itself sometimes. So that ringworm can spread, bend, or spread out in different ways that are not always going to be in a ring-like appearance. Best way to take care of it is with sprays and powders, usually some type of doctor-recommended ointments. A lot of people will sometimes just go with Lotrimin, since that is an antifungal thing that is over-the-counter and easy to get. Now, you don't want to actually scratch it. Reason being is it is a spore style infection, quote unquote. And so if you open that up, now those spores go elsewhere, as well as you have broken the skin now in an area that is already compromised. So now you are going to become more compromised to having an infection come in. Remember, your skin is a barrier. If you remove that skin and that ringworm style stuff is an opening for things to get through that skin barrier, you're leaving yourself open to viral and bacterial related infections that could get into the body. Tinea pedis, like I said, the tinea is the actual fungal infection. Pedis is simply just the location of it. This one we're going to find more or less between the toes. All right, it says most common between third and fourth toes, but it could just appear anywhere really on the foot-related area. Just happens to be most common there. You can also find it along the arch of the foot. Really, you would only find that in people that are more barefoot than anything else within the arch, just because it has a special layer of skin all on its own that kind of helps that from not happening, but that's getting more into detail. Pretty much it'll cause a lot of scaling. It can sometimes be associated with athlete's foot. Another thing you're going to notice is that you can get it with multiple styles of, I would say, contact. Mainly all of them are going to deal with it being too humid and being in that humid environment for way too long. So it says here, feet being too wet too often, extreme itching with small pimply rash, and then scratching can cause breaks in the skin and an infection, kind of like we talked about in the previous slide. And so from the picture over here, it's going to look red, white, or gray scaling. So the red will actually indicate possible inflammatory response before the actual blooming effect takes place. The gray at this top portion picture is that graying of the skin that's taking place. That is a good indicator of it. And then obviously that gray scaling that you're seeing at the bottom, or the white in that bottom right picture, can also just be an indicator of like a more advanced version of that infection, because now we have actual skin flaking going on because it can't keratinize properly. So treatment for this is going to be another type of antifungal cream, usually known as Griseofluvian, and that is more or less not because general toe area, but because it also has a good amount of zinc in it too, if I remember correctly. You can correct me on that if I'm wrong, but the zinc is an oxidizer that kind of helps pull away a lot of that moisture that you would usually get. So especially if you're wearing socks a lot of the time, that'll kind of make sure that you don't actually get any of that extra retained moisture in there. So it's a bit of a stronger cream for the specialized area. So the prevention of tinea, make sure you keep your feet dry. A lot of times people will use baby powder or Gold Bond or other forms of powders that can kind of help make sure that things stay dry and remove humidity through an area. Now, make sure you're taking thorough showers to kind of help prevent other related issues, and then drying your feet completely and fully afterwards as well. That will help out a lot. Make sure you're also cleaning your shower floor. Technically speaking, if you don't do a thorough enough job cleaning your own feet, the next time you place your feet on that ground, you could be putting old, stinky, now bacterial-ridden ground infection back on your feet that's a couple days old. So, clean your floors, all right? It's important. Other things to go over. Common cold. Technically speaking, the common cold is about 10,000 different possible viruses or bacterial infections that you can get, but we all just kind of bring them all together and call it the common cold. Now, there is a method to the madness in how you can get colds. Stress can cause you to be more susceptible to getting sick because it will actually have an effect on your body's hormonal response, decreasing immunity levels to infections that get in the body, causing you to get sick more likely. All right? That can happen. It's a thing. So if you're overworked, stressed, not getting enough sleep, pretty much things that can affect your body's ability to create its hormonal cycle will eventually cause a type of breakdown of your body's ability to fight off infections. So that's a fun fact. Now there's multiple ways to become susceptible to this as well, outside of just psychological factors. We also have chronic inflammation from local infection. So if you have a scab and you keep picking at it over and over again and it keeps healing, that can also do that. Allergy, inflammation, dust, those are other common causes. Technically speaking, if you have recurring allergies, your body has an autoimmune response. Now it's going to spend most of its time fighting off its own body. It's going to get tired, have some breakdown, and then leave you more susceptible to infection. Now, a lot of these things can actually be transmitted through sneezes, coughs, talking, touching, and then rubbing open airways that can actually get infected, such as eyes, ears, nose, or throat. Now, the reason why sneezes, coughs, and talking can sometimes be seen as not more so talking, but definitely sneezing and coughing, is that's actually your body's autoimmune response to actually trying to get rid of stuff that is in those passages. If you're coughing, you have something that the body has placed in that specific area, and your body's response is trying to get rid of it. That is why people that are sick and they feel a little congested, they take something like Mucinex, which is a decongestant, because they're trying to get that out of their body. So while most commonly you would try and take something that'll kind of stop the coughing and stop the runny nose and symptoms, what you actually want to do is you actually want to try and crank that up a bit more so you can actually get all of that stuff out of your body, because your body's trying to get rid of it. So, sorry about that little rant there. Moving on to the signs and symptoms, you're going to have malaise, or pretty much just uneasiness, tiredness, fatigue, headache, sneezing, sore throats, all the stuff that you would usually get with a common cold. Best things to do, make sure you're not near anybody so you don't get anyone sick. Bed rest. Make sure you're still eating, taking aspirin, antihistamines, and avoiding intense training with a respiratory infection. Reason being is because you have a respiratory infection, you're trying to do some type of cardiovascular training, you're actually doing it at a decreased rate, your body is not aware or ready for it, and so you can actually cause more harm than good. Flu, similar to the common cold, just on the other side of the spectrum. We have cold and flu medications now, so usually those things can kind of go together. One of the indicators is actually the level of, I would say, body temperature that you would have. Most commonly, if you have the flu, you're going to have a higher core body temperature as compared to having the common cold. So, with the flu, you're looking at more bronchitis, weakness, sweating. You're actually not going to want to eat as much most of the time because your body's trying to fight something off. So with this, a lot of the same stuff. It's going to be aspirin, steam inhalation, because we're going to want to try and break up that bronchitis, that infection that's going on within our lungs, and plenty of bed rest. Now, stay away from infected people. This is a bit more of a worrisome thing than an actual common cold due to that high, I would say, common core body temperature that we can reach, because if a flu is bad enough, it has the possibility to actually go even higher than that, and that's when you start getting that 104, 105, and then you have to go to the emergency room for the flu. We don't want that. Asthma. We've heard about asthma. We've talked about asthma before. I'm sure you've heard about it a couple of times. Now that I'm thinking back on it, I don't think we really touched on it that much, maybe once or twice. This will be a bit more detail for all of you. So, asthma can be caused by a couple of things. Kind of getting a baseline of what asthma is, it's pretty much difficulty breathing. That is the most easily characterized thing to get. But what can cause the asthma itself to actually occur more often is having a hard time getting breath in. So having a respiratory tract infection, bronchitis, anything of the like that will make it harder to breathe is going to cause it to flare up more. So this is a bit of a bigger deal when you have the flu and you have asthma, because it could cause it to flare up more and more intensely than normal. So signs and symptoms, you're going to have difficulty breathing more so than normal. Dizziness sometimes, because again, getting oxygen into the body is going to be harder. Coughing, wheezing, shortness of breath. Now, when somebody actually has an asthma attack, a lot of common symptoms is actually going to be the straw effect, where it's going to be easy to breathe in, but you're going to hear or feel or anything like of a wheezing feeling going outward, actually. So, kind of interesting methodology into how that actually happens. Thought I'd bring it up to you so that you kind of hear about it and can kind of put that into practice. It's easy to diagnose if somebody got the wind knocked out of them or if they're having an asthma attack that way, so you can find out how to treat them. So, find and control the source. Have them use an inhaler. You should have an albuterol inhaler on site wherever you are working regardless. If not, see if they can bring their own. Technically speaking, they should always bring their own. If you have athletes like that, make sure you check with them. Make sure they bring theirs with them. Make sure you check their inhaler so you know it's not out of date and is still working. If it isn't working within about the first 5 to 10 minutes after you've given them 2 or 3 rounds of it, immediately call 911, start getting them taken to the hospital, because they are fighting really hard to catch their breath and they can't do that forever. Exercise-induced asthma. Now we're going into what is more common and what you might see more often, which is people who are asthmatic and they have asthma in the past. They're going to have flare-ups when they do exercise. It's going to happen 9 times out of 10, so it's best to learn how to deal with it. Now, this face swelling, it's going to be associated as redness of the face. They're going to have a lot of chest tightness, shortness of breath, coughing. Sometimes they might feel nauseous. They might feel fatigue where they feel like they're about to faint. That is normal. Headache, and they're going to have that red skin, kind of like heat exertion. That's going to be a common one. Now, treatment. Now, it says to use the inhaler 15 minutes before exercise. That is more of a early onset prevention measure to try and help vasodilate their passageways so that they can breathe a little bit easier before the start of exercise. And that way it can kind of help eke off the possibility that they're going to start to constrict and make it harder for them to breathe as they go through exercise. Most of the time, if you're doing a very hard day of activity, it's recommended that they have it on hand because they could still have an asthma attack. Make sure they're doing good warm-ups and cool-downs because the body needs to warm up and be ready for that style and level of activity. So the other thing too is it says here to have them avoid long continuous runs, but you can actually build up their resistance to that if you have them do moderate intensity runs on their own throughout the weeks. Mononucleosis, mono, the kissing disease. So it's a virus that produces severe tiredness and spleen enlargement. Remember, if you have a spleen enlargement, you can't practice or play or participate because there's a possibility you can rupture. Usually it's carried by the throat or saliva, so tongue kissing a lot of the time. Signs and symptoms. Within 3 to 5 days, you're going to start getting headaches, fatigue, a lot of decreased appetite, muscle and joint pain sometimes. And then after that, it's actually going to get worse. It's going to proceed as a fever. You're going to have a high fever, usually 102, 103 degree fever. You're going to have swollen lymph nodes down the actual sides of your neck. All right. So those lymph nodes are going to be your biggest sign, I would say, that you have mono. Usually, I would say that's the number one indicator. That is your gold standard for seeing if somebody has mono. Because sometimes you aren't looking what the palate of someone's mouth looks like. That might look normal for them. It might not. Everyone is different. Within 2 weeks, they're most likely going to have an enlarged spleen. Sometimes they'll show jaundice. If they're showing jaundice, that is technically a medical emergency. You'll send them in. Again, there's a small chance that they might have a skin rash and some puffy eyelids. Again, puffy eyelids could be from allergies or lack of sleep, so it's not the best test, but along with the other things you're seeing, it is a possibility for a good way of seeing if they have something wrong. Return to play. Make sure they take their time. They're going to need, obviously, a doctor's referral in order to get back into sport. Usually an MRI to make sure that the spleen hasn't actually gotten more enlarged and that it has actually gone down. No fever. Liver function tests are normal. That depends on the district as well as the style of, I would say, methodology. Do they need a liver test in order to actually get back to it, or are they okay without it? And all the side effects must be gone. Next, we are talking about the female athlete triad. So pretty much this is 3 things that when they kind of come together, they coalesce into what is known as the female athlete triad. Pretty much it is the result of 3 things happening, causing 3 symptoms. So pretty much, if you do not eat as much as you should, you work out way too much, and you are pretty much not taking care of your body, either by doing too much or having some type of, okay, what I should say is this third and last one is more of a variety of symptoms. So, not eating well, working too hard, which usually can cause a lack of a period, and then moving on to osteoporosis or bone weakness due to a variety of causes, which is why it simply says osteoporosis. Most of the time, there is going to be some specific reason that falls within that osteoporosis category that you'll look at that'll be a sign or symptom of that. So sometimes it is calcium deficiency or iron deficiency or some other forms of irritation or, I would say, stress that can actually be inserted into that category either with osteoporosis or to overtake it and replace it. So a lot of times as we go through this and we look, you're going to have an eating disorder, usually anorexia, bulimia, or excessive exercise is going to be in that first category. So either you're working out so much that it doesn't matter how much you eat, you're just burning all of it. And signs and symptoms of this is going to be a lot of chronic fatigue, a decreased immune system, depression. A lot of times you're going to see these people also have sleeping disorders as well. So they are the people that are drinking like 200 drinks a day. They are working out at 12 o'clock at night, but getting up early so that they can go to school or work because that is how they kind of deal with things. Amenorrhea, or lack of a menstrual cycle, or an irregular menstrual cycle. So it might come early or late by upwards of 1 to 2 weeks for longer than 6 months. So this is bad because we're going to need that estrogen for bone growth, which is, again, taking part of that osteoporosis. Because what happens is if we have an irregular cycle with our menstrual cycle, we're now looking at a decreased production of estrogen because we haven't actually had our fluctuation after the period is supposed to end. So we're not getting that recycle where the brain is actually telling the body, hey, listen, we need to produce more estrogen again and get that pumped up so that we can get ready for our next follicular phase period. But until that point, it's just going to keep going down, down, down until it hits kind of a low and stays down there. And it could stay like that for a couple of weeks even, which can lead into that osteoporosis. It's osteoporosis, the condition where bones start to become weak, brittle, or less dense than they should be. And so you are now more at an increased risk of regular fractures as well as stress fractures. Now, it shows here for the hip, spine, foot, and tibia. You have to remember that technically bones work on fulcrums, which means you're going to find these in specific places. So for the foot and tibia, you're going to look at in the point where somewhere within the middle arch or ball of the foot is a good spot where you might find some stress fractures. Looking along the tibia, anywhere along that fulcrum length, if you were to try and almost bend it, so more of the middle of the tibia, you can get stress fractures. And then if we are actually to look at the hip and spine, for the hip, it's actually going to be at the pretty much the neck of the femur. And so if you were to try and fulcrum the leg, you would actually get a lot of pain in that neck of the femur because it takes a lot of weight technically, especially since women have wider hips. It has a longer lever arm, and so it has more stress placed on it. For the spine, for obvious reasons, it's going to be that decompression as well as extension style movements such as gymnastics or cheerleading you can see that in. And so treatment for this, normal exercise, core stability exercise work, heating habits, and you're going to need professional help for this. You are going to need to see a doctor, and you're going to need a serious plan in order to try and take care of this. This is not something you can actually do on your own, all right? You are going to need to get a bunch of people in your corner to kind of help you with this. Because most of the time when you have something like this, it's usually associated with, like it says at the top, an eating disorder. So there's a lot more going on that you need to worry about than just them having this female athlete triad. Best ways to prevent injuries in youth sports: pay attention. They don't know what they're doing all the time, so you have to be more careful with youth athletes than you will be with adult or teen athletes. 10% of ER visits are by an athlete under 15 years old, all right? These are easily preventable things by teaching them the right mechanics and the right things to do. So, another thing, if an athlete is complaining of pain and they're a youth athlete, chances are they have something going on and they're coming to you because something is wrong with them. A lot of times, kids don't always do that. Sometimes you have your worry warts, but if some kid that usually doesn't come up to you comes up to you with a problem, something's probably wrong. Make sure they actually want to play the sport. You don't want them to be forced into it. Because sometimes if an athlete keeps coming to you with recurring injuries or an injury that he says isn't going away, maybe he doesn't want to play a sport and he's looking for an excuse to get out. It happens more often than not. I get at least 3 or 4 every single season at the high school. Another thing, weight training. So, it needs to be properly performed in the first place and properly supervised with the right amount of staff at any moment in time. But the other thing too is weight training can actually help prevent these youth athletes from getting injuries as well. All right? The stronger they are, the more they can actually handle certain movements. And while this strength isn't actual muscle strength, it's motor unit strength, which is an early precursor to kind of help them gain strength later on as they get older and they start developing more sex characteristics and start getting more hormone production. Protective equipment. Make sure that they are actually wearing all the equipment that they're supposed to. All right? Now, this doesn't guarantee that they're actually not going to get hurt, but obviously it will mitigate the likelihood of getting injuries. Okay? So, Soccer players, wear your shin guards. You're going to make contact with other people. Football players, wear your pads. Lacrosse, elbow pads. They don't like wearing them at first, but you got to force them to wear them. Stuff like that. Now, another thing too, this is more or less for the wrestlers and gymnasts, but I would say avoid rapid weight loss or stressing thinness. All right, now the stressing thinness, you're going to see more actually, and I would say cheerleaders as opposed to gymnasts. Gymnasts, that is actually kind of fallen out due to the fact that their ability to perform is tied to how they feel. So if they feel better from eating, then that is going to be something that they're going to focus more on. But sometimes with cheerleaders, especially with people who are known as flyers, they might try and force themselves to diet so that they are easier to actually throw around, so on, to kind of help with that development. Another thing, avoid rapid weight loss for wrestlers. Now, sometimes there are youth wrestlers that are great in their weight category. And so as they get older, they will try and maintain that weight. So you might have a 100-pound kid try and stay 100 pounds through their entire high school career. All right, you can see how that's probably not good for their actual development and growth. They're stunting their ability to actually grow vertically and outward, and sometimes, obviously, will hinder their ability to develop their proper sex characteristics and secondary sex characteristics, allowing them to actually develop and grow later on in life. So they might have stunted growth for, again, like I said, the rest of their life, going up in their 20s, 30s, 40s, so on and so forth. All right, that is everything. I know I said I would try to make it short, and then I decided to go on this giant tangent, and we're sitting at like 26, 27 minutes now. So I'm going to let you go here. Again, everyone, congratulations on getting this far. Good luck on your exams, and I will see you all Thursday. Good luck.